So this is about interspinous ligament. Suppose if we see, this is the body of the vertebra. This is the body of the another vertebra. This is spinous process. This is spinous process. This is also spinous process. This is spinous process. Interspinous ligament means the ligament which is present between two spinous process. This is called interspinous ligament. Okay? Interspinous ligament. Here, first point. This interspinous ligament is going to cover the space between two spinous process through the oblique fibers. See, here it will be in oblique nature through the oblique fibers. Next point, it is going to present over the cervical, thoracic and lumbar regions. It is going to present over the cervical, thoracic, lumbar regions, and particularly at lumbar region, this interspinous ligament is well developed. Okay. Next point, in this lumbar spine only, at the lumbar region, this interspinous ligament is going to connect or contribute to the thoracolumbar fascia. Thoracolumbar fascia and one more joint capsules. Which joint capsule? Facet joint capsules. So that in lumbar region, this interspinous ligament is going to give contribution to the thoracolumbar fascia, and at the same time capsules contribution, nothing but attachment, is going to attach to the both thoracolumbar fascia and facet joint capsules. And one more point, as we discussed for flexion and extension. Suppose if we take one vertebral column, if this is anterior, this is posterior, this is one more vertebral column, this anterior, this is posterior. If patient is doing flexion, if patient is doing extension. When patient is doing flexion, the ligaments, these ligaments will stretch. Length will increase. If patient is doing extension, ligaments will be slack. That means loose. So this is one point. And last point about ligament. Last point about this interspinous ligament. Last point. It is weaker. This ligament is weak. It is a weak ligament when compared to the anterior longitudinal ligament, posterior longitudinal ligament, and ligament of flavum. Compared to these three, this ligament is weak. So that this ligament is having, this ligament is potentially is having less tensile strength. Tensile means we know less tensile strength this ligament will be having compared to anterior longitudinal ligament, posterior longitudinal ligament, and ligament of flavum. So this is about the interspinous ligament.